Assistant, let me get this. Okay, let's start the procedure, Miss Covarrubias. So please open your mouth. Thank you.
Wait lang, Dok.
Bakit?
I can't breathe.
Cardiopulmonary resuscitation, or CPR, is a life-saving technique that's useful in many emergencies, such as heart attack or near drowning, in which someone's breathing or heartbeat has stopped.
The most common medical emergency we deal with is heart attack or cardiac arrest. The symptoms include chest pain that lasts for more than 10 minutes. Pain can radiate to the left arm, jaw, back, and abdomen. While some people experience shortness of breath, fainting, fatigue, and sweating. This pain happens because of a blockage that stops blood from getting to the heart muscle.
So what will we do if a patient you're treating inside the dental clinic suddenly has a heart attack? When someone suddenly stops breathing and their heartbeat stops,
You perform CPR by following these steps.
When one is performing CPR, remember CAB, which stands for circulation, airway, and breathing.
If a person collapses with possible cardiac arrest, the first thing to be done is establish unresponsiveness and confirm the absence of breathing or the presence of only gasping respirations. Then you call for help or call an ambulance as soon as possible. 911 is the national emergency telephone number of the Philippines, managed by the Emergency 911 National Office.
First, one must clear the airway. When a person is unresponsive, their muscles relax and their tongue can block their airway so they can no longer breathe. Put the person on his or her back on a firm surface. You can clear the person's airway using held tit, chin lift maneuver. First, kneel next to the person's neck and shoulders. Put your palm on the person's forehead and gently tilt the head back. Then, with your other hand, gently lift the chin forward to open the airway. Tilting their head back opens the airway by pulling the tongue forward. If they are not breathing, their chest and stomach will not be moving, and you will not hear or feel their breaths.
for circulation, one must restore blood circulation with chest compressions. So first, place the heel of one hand over the center of the person's chest. It is between the nipples. After this, place the other hand at the top of your person. So keep your elbows straight and position your shoulders directly above your hands. Use your upper body weight, not just your arms. As you push straight down, you compress it. The chest at least 2 inches, approximately 5 centimeter. Push hard at the rate of about 100 compressions a minute. Continue to push in this way at the regular rate until helps arrive. If you haven't been trained in CPR, continue chest compressions until there are signs of movements or until emergency medical personnel take over.
The last one is breathing, where you breathe for the person. Rescue breathing can be mouth-to-mouth breathing or mouth-to-nose breathing if the mouth is seriously injured or can't be opened. With the airway open, using the head tilt, chin lift maneuver, pinch the nostrils shut for mouth-to-mouth breathing and cover the person's mouth with yours, making a seal. If you try to resuscitate someone using chest compressions only, you can't go wrong. People who provide first aid don't necessarily have to give the person rescue breaths. But if you feel confident that you can do it, for instance, following the first aid course, you should combine chest compressions with mouth-to-mouth resuscitation at a ratio of 30 to 2. After doing 30 chest compressions, you give the unconscious person 2 rescue breaths, followed by 30 chest compressions, and so on. It's very important to give the rescue breaths quickly so you don't interrupt the chest compressions for long. The rescue breaths shouldn't take longer than 10 seconds in total. This is how to give a mouth-to-mouth resuscitation. Gently tilt the person's head back. Use one hand to hold their chin and lift it up. Then keep their mouth open using your thumb.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 12 and 13 and 14 and 15 and 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 more breaths, 30 more compressions. I'd continue this until an AED arrived or until EMS showed up.
If a defibrillator becomes available, a person in ventricular fibrillation or pulseless ventricular tachycardia is given an asynchronous shock. If the initial rhythm is pulseless, electrical activity or asystole, an initial dose of epinephrine, 1 mg, should be administered as possible after recognizing cardiac arrest.
Adrenaline remains the drug of choice during cardiac resuscitation, and other drugs such as atropine, sodium bicarbonate, calcium, magnesium, and fibrinolytic drugs may be considered only in specific circumstances.
This is about the Itaewon Halloween crowd crush. 156 lives were lost in an unimaginable stampede last October 29, 2022 in the Itaewon district of Seoul. These are reports about how partygoers were asked to resuscitate victims by carrying out CPR despite never having done it before. So let's watch this video about the experiences of the survivors during the Halloween tragedy.
저기서 누구 쓰러졌다? 계속 그러고 신고해달라 하고 이런 소리가 엄청 많이 들렸어요. 그래서 한두 명이 쓰러지는 게 아니구나 하고
이제 위쪽부터 사람들끼리 밀어라고 외치면서 저희 쪽 인원들은 의지와 상관없이 내려막길로 몸이 밀려났습니다.
밀침을 당한 사람들이 자빠졌고 또 그 앞에서 다 빠졌어요. 그래가지고 사건이 시작됐고
중간중간에 너무 이렇게 압박이 오면은 숨도 못 쉬고 이랬었거든요. 여러분들이 울고불고 이렇게 하고 살려달라 이런 소리가 들렸었어요. 그 구조할 때까지 저는 거기 사이에 껴서 저도 있었거든요. 이제 구조대가 왔을 때 이제 경찰분들이 빼내주셔가지고 일어서 있는 사람들이 빠지고 나니까 넘어졌던 분들이나 이런 분들을 끌어내서 이제 길에서 이거 심폐소생술 이런 걸 하시더라고요.
제가 꺼내왔던 사람들은 이미 다 심정지가 온 상태여서 제가 심폐소생술을 진행하는 중에도 사람들은 계속 죽어갔습니다.
Problems that caused deaths of hundreds of people in this incident. There is lack of emergency medical services. There was no crowd control. Only a few security personnel were present, and there is lack of CPR education.
Since our focus is about CPR, we like to emphasize the lack of CPR education. Based from the reports, partygoers were just instructed on how to perform CPR despite not having experiences in doing so. More victims could have been saved if a lot of people are knowledgeable on how to perform proper CPR.
If you're afraid to do CPR or unsure how to perform CPR correctly, know that it's better to try than to do nothing at all. The difference between doing something and doing nothing could be someone's life. If you're not trained in CPR or worried about giving rescue breaths, Then provide hands-only CPR or uninterrupted chest compressions of 100 to 120 a minute until paramedics arrive. You don't need to try rescue breathing. But if you're well trained and confident in your ability, check to see if there is pulse and breathing. Remember, if there is no pulse or breathing within 10 seconds, you begin chest compressions. Again, you start CPR with 30 chest compressions before giving 2 rescue breaths.
So, why is knowing how to perform CPR so important? First, CPR saves lives. Next, you'll know what to do during a cardiac emergency. Sudden cardiac arrest is witnessed by a bystander in approximately 37% of cases. That bystander could be you. Being trained in CPR provides the knowledge, confidence, and skills to stay calm in a medical emergency and help the person in need. Individuals certified in CPR are prepared to make a difference in their community by being ready to jump into action anywhere a cardiac arrest happens. Ordinary people can do ordinary things when they have the skills, confidence, and bravery to step up and help the stranger in need.
Every minute counts in an emergency. With any medical emergency, every second counts. Victims of sudden cardiac arrest require immediate CPR to prevent damaging effects from a lack of blood flow to the brain, heart, lungs, and other organs. CPR can help increase the victim's chance of survival. The last one is faster recovery for the victim. When a person suffers from sudden cardiac arrest and receive early CPR, they have a higher survival and recovery rate. CPR can help restore breathing and blood flow, aiding in the person's recovery. In some cases, the victim may return to the life with minimal side effects after receiving high-quality CPR.
You don't need a special certification or formal training to perform CPR, but you do need education. If cardiac arrest happens to someone near you, don't be afraid, just be prepared. CPR saves lives. Currently, about 9 in 10 people who have a cardiac arrest outside the hospital die. But CPR can improve those odds.
If it is performed in the first few minutes of cardiac arrest, CPR can double or triple a person's chance of survive. That's all. Thank you.